Questions 361 to 380. 361. A 34 years old woman was diagnosed with breast cancer and underwent surgery. She is currently receiving monthly chemotherapy. She telephoned the clinic and notifies the nurse that she developed a sore throat. Which of the following foods would be the most appropriate to recommended? A. Fresh fruits and vegetables. B. Seafood. C. Dried fruits, nuts. D. Pasteurized cheese. The answer is A. Fresh fruits and vegetables. 362. Both parent have sickle anemia disease? A. 100%. B. 50%. C. 75%. D. 25%. The answer is A. 100%. 363. Both parent have sickle anemia trait. The percentage for the child to have the disease? A. 100%. B. 50%. C. 75%. D. 25%. The answer is D. 25%. 364. Which of the following circumstances is most likely to cause uterine atony and lead to postpartum hemorrhage? A. Endometriosis. B. Urine retention. C. Cervical and vaginal tears. D. Hypertension. The answer is B. Urine retention. 365. A 28-year-old woman attended gynecology clinic for conception counseling. The midwife assessed her pelvic diameter. Which type of pelvis is the most favorable for the normal delivery? A. Android. B. Gynocoid. C. Anthropoid. D. Platypeloid. The answer is B. Gynocoid. 366. A 15-month-old child is admitted for hypospadias repair. After surgery, which of the following instruction should be given to the parents? A. Limit activity for 2 weeks. B. Avoid apply ointment or powder. C. Give a child a diet that is high in protein. D. Isolate the child from other children with the infection. The answer is B. Avoid apply ointment or powder. 367. A 2-hour-old newborn baby is given to the mother to start on breastfeeding. The mother is reluctant as the thinks is too early for the baby. The mother finally agrees to breastfeed the baby after the midwife has discussed the advantages of early breastfeeding. Which of the following statement made by the mother suggests her correct understanding? A. Improve natural immunity. B. Strengthen sucking reflex. C. Stimulates gut movement. The answer is A. Improve natural immunity. 368. Establishes baby's hydration. A 11-month-old boy with cleft lip and palate was discharged from the hospital after surgery. The nurse provided the parents with teaching. Which of the following statement by the parents indicate appropriate understanding of the teaching instruction? A. I should avoid that my infant cries as much as possible. B. I will use a spoon to feed my child after the surgery. C. I will put my child in his abdomen after feeding. D. I will use lotion to ease my child's lip irritation. The answer is A. I should avoid that my infant cries as much as possible. 369. A newborn born by elective cesarean section under general anesthesia at 28 weeks of pregnancy. His weight is 850 gm and he is in 20th percentile in intrauterine growth chart. He is admitted to neonatal intensive care unit. Which of the following is the classification of this newborn according to stational age and birth weight using intrauterine growth chart? A. He is appropriate for gestational age. B. He is extremely low birth weight. C. He is small for gestational age. D. He is very low birth weight. The answer is A. He is appropriate for gestational age. 370. A baby born at 38 weeks of gestation with birth weight 1800 gram. Which of the following is the classification of this infant? A. Low birth weight. B. Very low birth weight. C. Appropriate for gestational age. D. Small for gestational age. The answer is D. Small for gestational age. 371. Which of the following would be the proper interpretation by the nurse for a chromosomal analysis showing 46XY? A. Normal male. B. Abnormal male. C. Normal female. D. Abnormal female. The answer is A. Normal male. 372. Which of the following would be the proper interpretation by the nurse for a chromosomal analysis showing 46XX? A. Normal male. B. Abnormal male. C. Normal female. D. Abnormal female. The answer is C. Normal female. 373. To measure fatal heat rate fetus daily activity through? A. Doppler sound. B. Weighting measures. C. Non-stress test. D. Daily fetus kicks. The answer is D. Daily fetus kicks. 374. Immediately following the birth of a full-term newborn, which of the following is the priority nursing diagnosis for this newborn? A. Airway clearance related to nasal and oral secretions. B. Ineffective thermoregulation related to environmental factors. C. Risk for imbalance fluid volume related weak sucking reflex. D. Risk for injury related to immature defense mechanisms. The answer is A. Airway clearance related to nasal and oral secretions. 375. A full-term newborn is admitted to NICU with a diagnosis of meningocele. Which of the following admission assessment is needed? A. Specific gravity of urine. B. Head circumference. C. Weight and length. D. Palpation of the abdomen. The answer is B. Head circumference. 376. A nurse is caring for a full-term newborn who was delivered 5 minutes ago. The infant's APGAR score was 8 at 1 minute and 5 minutes. Which of the following has the highest priority? A. Assessing the infant's red reflex. B. Preventing heat loss from the infant. C. Maintaining the infant in the supine position. D. Administering humidified oxygen to the infant. The answer is B. Preventing heat loss from the infant. 377. A 30-week gestational preterm admitted to NICU 2 hours ago. The neonate starts to have grunting, nasal flaring. Which of the following the nurse recognized regarding signs and symptoms? A. Neonate has RDS. B. It is normally in the first 24 hours of birth. C. This is not significant unless becomes cyanosis. D. A neonate has hypoglycemia. The answer is A. Neonate has RDS. 378. A 30 weeks of gestational age preterm is admitted to the neonatal intensive care unit 2 hours. The neonate starts to have grunting, tachypnea, and nasal flaring. Which of the following is responsible factors for diagnosis of the premature? A. Bronchial spasm. B. Immature bronchioles. C. Lack of surfactant. D. Pulmonary overload. The answer is C. Lack of surfactant. 379. A nurse in the neonatal intensive care unit is caring for premature newborn, is diagnosed with respiratory distress, RDS, and the doctor ordered administering surfactant. Surfactant should be given by which of the following routes? A. Intravenous. B. Subcutaneous. C. Intramuscular. D. Endotracheal. The answer is D. Endotracheal. 380. A nurse is performing physical examination on the newborn. She notes that the baby has cephalhematoma. This baby is risked to develop which of the following? A. Sudden death. B. Pathological jaundice. C. Infected umbilical cord. D. Increased intracranial pressure. The answer is B. Pathological jaundice.